Well, despite enacting some of the toughest lockdown rules in the country, Governor Gavin Newsom is facing a surge in new COVID cases across California. Our next guest calling the strict lockdowns a, quote, failure of imagination on behalf of lawmakers. Here to explain is Dr. Bhattacharya, professor of medicine at Stanford University. Dr. Bhattacharya, thanks so much for being with us. It does seem like lockdown, lockdown, lockdown. It's the cure-all. It's the instinctual, almost reflexive response from policymakers. Tell me why that's a failure of imagination.
I mean, the key thing, it doesn't respect the facts about this epidemic and about this virus. The virus spreads in households. It spreads basically in ways that we kind of know, whereas the lockdown sort of suppresses society in places where the virus doesn't necessarily spread a lot. It also, I mean, it reduces our ability to react to the virus. So, for instance, we closed our schools. Well, that means a lot of people who work in frontline settings, they have kids, and they can't go to work because they have to take care of their kids. The lockdown itself, even theoretically, all it does is it delays when the infections occur. Right. And in a sense, what's happened in California, we now bunch them up all right now, and our hospitals are starting to get stressed as a result. I mean, our hospitals are empty for large parts of the spring and the summer, weirdly.
Right. The idea behind lockdowns wasn't to kill the virus. It was to bend the curve. That's what we were told in early spring. So what would have been a better policy response, Doctor?
Well, we know that older people over 70, have a 95% survival rate from the virus. 5% mortality is pretty high, whereas under 70, the survival rate is 99.95%, 0.05% mortality. Older people are the ones who are at risk. We should have done everything we could possibly do to protect older populations. Let me give you one failure where I think it's just so obvious once you say it. Mm-hmm. There are people who are, say, 64, 65, they have diabetes. They're actually at high risk of mortality, and yet maybe they're a clerk at a grocery store or a janitor. Well, we call them essential and expose them to the virus. We should have been protecting them. Our policy should have been designed to give them leave or
more tailored, less blunt. That seems pretty obvious. Yeah. I'd have to see if I can get to two big important stories with you really quickly. You brought up elderly people in our society who are most vulnerable. There's this emerging debate among health experts who should be prioritized when it comes to the vaccine. Should it be older Americans, or should it be used as a chance for racial equity? Should we prioritize essential workers who have more minority populations, more represented by minority populations? Should we be taking race into account, Doctor?
I think the key thing is if we want to minimize mortality from this virus, what we need to do is prioritize older people, and especially people with chronic conditions. Right. Minority populations with chronic conditions should be prioritized, absolutely, especially older people. I mean, I think that's the key question. What do you want? If you want to reduce deaths from this virus, prioritize older populations.
Seems obvious. Really quickly, because you're from Stanford, I have to ask you about the story, the controversy about Stanford prioritizing, professors at the higher level and not frontline workers. What's your response to what happened in Stanford in the vaccine distribution there?
I mean, I think they made a mistake prioritizing people like, people like me, I guess, although I haven't had the vaccine as yet. They should have been prioritizing people who really at the front line, especially those who take care of older people. Right.
Really, really good information, a lot in a little amount of time. Dr. Bhattacharya from Stanford, thanks so much for your time this morning.
Thank you, Will.